Eye movement desensitization and reprocessing, EMDR, is a therapeutic approach developed by Francine Shapiro in the late 1980s. It was initially designed to help individuals struggling with post-traumatic stress disorder, PTSD, and has since been employed successfully to treat a wide range of psychological issues and traumas. At the heart of EMDR is the idea that traumatic experiences can become stuck in the brain, causing emotional distress and symptoms that persist over time. EMDR aims to unblock and process these distressing memories, allowing individuals to heal and move forward in their lives. The EMDR process. The EMDR is a structured 8-phase approach that involves specific procedures and techniques. Here's an overview of the EMDR process. 1. History taking and treatment planning. The therapist begins by gathering information about the client's history and identifying the target issue or traumatic memory that will be the focus of EMDR treatment. Together, the therapist and client develop a treatment plan. 2. Preparation. In this phase, the therapist explains the EMDR process to the client and helps them establish a sense of safety and trust in the therapeutic relationship. Clients learn coping strategies and relaxation techniques to manage distress. 3. Assessment. The therapist and client work together to identify and explore the specific memory or memories related to the target issue. Clients are asked to rate the level of distress associated with these memories. 4. Desensitization. This phase involves the core EMDR technique. Clients focus on the distressing memory while simultaneously engaging in bilateral stimulation, typically achieved through guided eye movements, taps, or auditory cues. Bilateral stimulation is thought to mimic the brain's natural processing mechanisms during rapid eye movement, REM, sleep. Clients report what comes to mind during each set of bilateral stimulation, and the therapist guides the process. The goal is to reduce the emotional charge and reprocess the memory, making it less distressing. 5. Installation. Positive beliefs and emotions are targeted in this phase. Clients identify and focus on desired positive beliefs that can replace negative beliefs associated with the traumatic memory. These positive beliefs are strengthened through bilateral stimulation. 6. Body scan. Clients are guided to pay attention to any remaining physical tension or discomfort associated with the traumatic memory. Bilateral stimulation is used to help release any residual somatic distress. 7. Closure. At the end of each session, the therapist ensures that the client is in a state of equilibrium and provides guidance on self-care strategies. Clients are encouraged to maintain a journal to document any emerging thoughts or feelings between sessions. 8. Reevaluation. In subsequent sessions, the therapist and client review progress and reevaluate the distress level associated with the target memory. Additional processing is undertaken if necessary. The mechanism of EMDR. The exact mechanism by which EMDR works is not fully understood, but several theories have been proposed. 1. Adaptive information processing, AIP. The central concept in EMDR is adaptive information processing, AIP. This theory suggests that traumatic memories are stored in a fragmented and unprocessed form in the brain. Through bilateral stimulation and guided processing, EMDR helps integrate these memories into the individual's overall memory network, reducing their emotional charge. 2. Dual attention. The EMDR requires clients to maintain dual attention, focusing on the traumatic memory, while also attending to external bilateral stimulation. This dual attention is believed to facilitate the brain's ability to process and reorganize traumatic memories. 3. Neurobiological changes. Studies using neuroimaging techniques have shown that EMDR can lead to changes in brain activity, particularly in regions associated with memory processing and emotional regulation. These changes may contribute to the therapeutic effects of EMDR. Applications of EMDR. Originally developed for the treatment of PTSD, EMDR has demonstrated its effectiveness in various clinical settings and for a wide range of psychological issues, including trauma and PTSD. EMDR is a well-established treatment for trauma and PTSD, helping individuals process distressing memories and reduce associated symptoms such as flashbacks, nightmares, and hypervigilance. Anxiety disorders. EMDR has been used to treat various anxiety disorders, including panic disorder, social anxiety disorder, and generalized anxiety disorder. Depression. EMDR can be integrated into the treatment of depression, especially when traumatic experiences contribute to depressive symptoms. Phobias. Specific phobias, such as fear of flying or heights, have been successfully treated with EMDR. Addictions. Some therapists use EMDR to address underlying trauma or emotional issues that contribute to addictive behaviors. Pain management. EMDR techniques have been applied to help individuals manage chronic pain by addressing the emotional aspects of their pain experience. Criticisms and controversies. While EMDR has garnered empirical support and is widely practiced, it is not without its criticisms and controversies. Some key points of debate include: mechanism of action. The precise mechanism by which EMDR produces therapeutic effects remains a topic of discussion and investigation. Placebo effect. Some argue that any therapeutic gains achieved through EMDR may be due to a placebo effect or the therapeutic relationship with the clinician. Lack of long-term data. There is a need for more long-term follow-up studies to assess the durability of EMDR's effects. Conclusion. EMDR has emerged as a valuable and empirically supported therapeutic approach for trauma and a range of psychological conditions. It offers hope to individuals who have experienced distressing events and provides a structured method for processing traumatic memories. As research continues to uncover the mechanisms underlying EMDR's effectiveness, it remains a promising tool in the field of mental health and trauma recovery. We are House of Thought Therapy, nurturing minds, empowering lives.